I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery for coronary artery bypass surgery in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's a yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, "Mr. Phillips, did you eat before you came to the hospital tonight?" He said, "Yes." I said, "What did you have?" He said, "I had a cheeseburger and a milkshake." And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. Well, 30, 40, 50 years of keeping your blood very fatty creates changes in the blood vessels that are very dangerous.
Over the years, arteries can become clogged with fatty material. Then a blood clot can form, blocking the blood flow completely. If the artery leads to the heart, the lack of oxygen can cause heart muscle to die. That's a heart attack. If the clogged artery leads to the brain, the patient has a stroke.
The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
Hello! So, you're here to find out what it's like to have a heart attack. Well, we don't have much time because with heart attacks you'd never do. Well, let's start with the first symptom most people think of. Yes, chest pains. Well, we've all heard of the classic chest pains, but it may not always be that severe. It could be a bit of tightness or discomfort in and around the chest. No doubt you'll shrug this off. I mean, slight chest discomfort, tightness, not worth worrying about, right? Wrong. What if it spreads to your arms? Still not convinced you're having a heart attack? Or what if you feel dizzy, lightheaded? Oh, still thinking, don't make a fuss. What if it spreads to your neck, to your jaw? You're probably thinking, tough it out, it will pass. What if it doesn't? The longer you leave it, the more your heart dies. How about difficulty breathing? Rising panic, sweaty, clammy. Could be indigestion, last night's curry. Stress. But what if it's your body telling you to get help? Don't kid yourself. If you're having chest pains or discomfort with any of these symptoms, or even if you're feeling unwell, dial 999. Now this may surprise you. The ambulance service would rather see you and discover it's not a heart attack than arrive too late. Every second counts. I know you think you'd feel embarrassed if it's not actually a heart attack, but imagine how you'll feel if it is, and you left it too late. Imagine that.
Hello, I am Deb Berg, and we're here at the Healing Stop where we do cardiovascular screening, meaning heart tests, to check you for blockage and hardening and circulation problems. As you just saw in those films, Heart disease is the #1 killer of Americans today. About 50% of the population die from heart disease, and cancer and diabetes and blood pressure and cholesterol problems. They're just a few of the many things that are taking the lives of Americans after 50 years old. And I would like to tell you a little bit about why I'm here. I started in the funeral business 11 years ago, helping people die for a living. I did final expense insurance, helping set up people's funerals when they were sick. And I saw a lot of sickness and death and dying too young in life. And so I began praying, and I could write a book asking God to show me why so many people were dying horrible deaths. And what he showed me is that it's our diet that is killing us. And so we do here at the Healing Stop, we coach people on health and wellness naturally. Let your food be your medicine and your medicine be your food. We do not have to take drugs. We're not sick because we're drug deficient. We're sick because we're nutrition deficient. So what I'd like to do is show you some statistics on what you just saw there, heart disease, why it happens. It can totally be stopped, prevented, and even reversed, but we've been brainwashed, lied to, and misinformed on what causes it. If you would think about these statistics, a heart attack happens every 20 seconds. Over 1 million a year will die of heart disease. 50% of heart attacks result in sudden death. A death happens every 60 seconds from heart disease. 50% of all deaths in the U.S. are caused from heart attacks. It kills more than the next 9 causes of death, and even 500,000 women every year will die from heart disease. But the really sad thing is 60% of our youth already have it. So with that just goes to show you, if you know someone who has high cholesterol, high blood pressure, diabetes, low energy, impotence, the Viagra and the erectile dysfunction is all of that is caused from blocked arteries. And you're probably in danger if you're experiencing any of those problems. There's a saying that says anyone over 50, you either have heart disease or you don't know you have heart disease. So let me go back a minute. I was in the funeral business for 11 years, and after I took a heart test when I was about 54, 55 years old, and found out that I had major blockage in my arteries. Now, I've never been heavy, never smoked, never drank, but found out that when I went and took this test that I had blockage. I ate a lot of meat, cooked food, the standard American diet, but when my friends were out eating cheeseburgers and milkshakes, I would eat pieces of meat and some cottage cheese, and I didn't drink pop, or I would drink water. So I was able to keep my weight down, but I was clogging up my arteries. And when that happened, and I took this test, I found out I was majorly blocked in my carotid arteries, and I was a heart attack waiting to happen, or a stroke. So this got me interested, and I started researching and found out why I had heart disease. Okay, so I'd like you just to really think about this. I'm going to build a puzzle picture for you today, so please don't leave. If you watch this through, you will understand things you never understood before. The common sense in this, I am not going to try to convince you of anything. I'm going to try to reason with you, and I'm going to take you on a journey and a tour that when I get done, I promise you, you won't think the same and you'll get it. So I'd like you to start by looking at this picture. This tells it all. This is a picture of an artery. There's 3 different size arteries in your body. The size of a garden hose in your heart, go down the arms and legs, the size of spaghetti, and if you go to the fingers and toes, those are the size of hairs. Your blood flows through your body 4 times every minute. And if any of those arteries are blocked, there's 100,000 miles of them. If they're blocked anywhere, you're going to have a stroke or heart attack. And that's why people start experiencing pain and blood pressure problems, because the pressure from the no blood flow. As you can see in this picture, this is a cartoon of an artery, and this is a real artery. It's kind of like a cartoon. This is obviously blown up. This is healthy blood. This is blood with fat in it. If I might stop here for a minute and tell you, when you eat the standard American diet, and there's 2 things that consists of. Animal products, that's anything with a face, a liver, a mother that walks, crawls, or swims, or anything that comes from one of those, which would be milk, eggs, cheese, and butter, or something that you grew in an organic garden, even your own organic garden, when you cook it, bake it, boil it, broil it, steam it, fry it, grill it, box it, can it, homogenize it, pasteurize it, heat it over 112 degrees, you've killed the enzymes. And then when you add soda pop and you add pastas and breads and processed foods and fast foods and potato chips and candy and cake and cookies, what happens to your arteries is it's called hardening of the arteries. Those foods are all processed dead foods, and we all eat them. It's the standard American diet. They call it the SAD diet. It causes your artery to crack and bleed like a garden hose out in the sun. They dry out and they get all corroded and dried out, and the body sends a gooey, goopy stuff called LDL cholesterol. It's I call it a tire patch or a Band-Aid. It's a mending material that repairs that artery. It's sort of like a scab. If you cut your hand and you bleed, you'll notice you'll bleed for like 3 minutes, and then all of a sudden you'll form a scab or a sticky substance that'll stop the bleeding, and then in about 2 or 3 days you'll have a little scab. That's called cholesterol. Imagine that happening in 100,000 miles of arteries. Those arteries start repairing. Your body is programmed by God to send that out when you get a crack. And so your body will repair that, and then after about 10 years, you'll have scar tissue around. But when you eat animal products or processed foods, fats and sugars, the fats in your foods, whether it's in eggs and cheese and butter or fats from eating cookies and cakes, that sticks to that cholesterol and it causes even more blockage. So the worse your diet is and the more fats you eat, the more quicker you're going to have blockage. So to sum it up, you eat a dead food diet of animal products and processed foods, and your arteries start to crack, hardening the arteries, usually at around 40 years old. The body repairs with cholesterol. Cholesterol is a very important substance that repairs you. God put it in your body to repair you. It makes up 70% of your brain. You need it. It will repair. It's not thinking about clogging your arteries. It's trying to keep you from bleeding to death. Then you eat the meats and the cheese and the butter and the milk and the eggs, and it causes a slow process of plugging up your arteries. So your garden hose, dried out sized artery gets plugged up. And then 2 things happen. The doctor puts you on a cholesterol drug, so you can't make it anymore. You can't do that, because when you do that, it causes your body, your brain, a lot of people have Alzheimer's today. They can't get enough cholesterol in their brain, and the more older you get, the more you need more cholesterol. And so what happens from another view is from the time you're born till you're 50, animals kill you from the grave. You kill them to eat them, they kill you back at about 1% a year by coating your arteries. First of all, they start cracking from drying out, not usually till you're in your 30s, 40s, it starts happening. The more bad food you eat, young people eat a lot of fast food, the quicker that's going to start happening. So it's never a uniform way, but typically by 50 years old, we've got blocked arteries. And that's when you start having pressure problems, because when your artery slowly closes up from repair and animal products, and then the blood tries to go through, it can't. So it slams into that hardened artery all day long with every beat of the heart. It's hitting that dried out hardened artery, and then the artery bursts, you have an aneurysm, or you can have a stroke if it gets in your neck. If it gets in your legs, it's called peripheral artery disease, PAD, because you get real bad pain in your legs. And we're going to talk about how you can fix that. But for now, I want to start by telling you why that happens.